Hello everyone, today we'll be talking about contraception. So when we just look at the word contraception, contra means against and seption means formation of a new thing. Okay, so basically the definition of contraception is it includes all measures temporary or permanent designed to prevent pregnancy due to the coital act. Or we can also define it as the deliberate use of artificial methods or other techniques to prevent pregnancy as a consequence of the coital act. So methods of contraception, we've got temporary and permanent methods. So temporary methods consist of barrier methods such as the use of condoms, natural contraception, intrauterine contraceptive devices, which can be hormonal or non-hormonal. Then we have steroidal contraception, which can be in the form of tablets or implants. Then we have permanent contraception. So in females, it's tubal occlusion, which is also referred to as bilateral tubal ligation, in which we ligate the fallopian tube. And in males, there's vasectomy, in which we ligate the vas deferens. So when we talk about the failure rate of contraceptive methods, so no method has the highest failure rate, which is about 85%. The natural methods such as use of monitoring the calendar, monitoring basal body temperature, mucus secretion has a failure rate of about 25 to 30%. Then condoms have a failure rate of about 15 to 20% if not used properly. Then IUCD has a very low failure rate, which is about 0.1 to 0.8%. Then combined oral contraceptive pill has a failure rate of about 0.1%. Progestin-only pill has a failure rate of about 1%. Then implants have an even lower failure rate, which is about 0.01 to 0.05%, okay? And vasectomy or and tubectomy, which is our permanent methods, they have a failure rate of about 0.15%. So when we talk about barrier methods, so these are methods that are used to prevent sperm deposition in the vagina or prevent sperm penetration through the cervical canal. Okay, so this can be achieved using mechanical methods, chemical methods, or a combination of both. So in the mechanical for the males, we've got the condom, for female condom, diaphragm, cervical cap. And the chemical, we've got vaginal contraceptives, we've got creams, jelly, or foam tablets which can be inserted. Then combination, that's where we can combine mechanical and chemical methods, that is to reduce the failure rate. Now, what are the advantages of the use of condoms? So they're cheaper with no contraindications, there are no side effects, easy to carry, simple to use, and disposable, protect against STDs such as gonorrhea, chlamydia, HPV, and HIV, protect against pelvic inflammatory diseases, reduces the incidence of tubal infertility and ectopic pregnancy, protection against cervical cell abnormalities, and it's useful where the coital act is infrequent and irregular. Disadvantages include it may accidentally break or slip off during coitus, inadequate sexual pleasure, allergic reaction to latex. You need to discard it after every coital act, and the failure rate is about 15% if not used properly. Then we go to the diaphragm. So this is how a diaphragm appears. So the inner surface has contraceptive jelly. Okay, then that's how you insert it to cover the cervix. So that's how it's supposed to be, okay? So advantages include it's cheap, it can be used repeatedly for a long time, reduces PID, STIs to some extent, protects against cervical precancer and cancer. Disadvantages requires the help of a doctor or paramedical person to measure the size required. There is risk of vaginal irritation, abrasion, and urinary tract infections, and it's not suitable for women with uterine prolapse. Failure rate is about 15 to 16%. Then fertility awareness method, this is whereby you monitor your rhythm. So what are the advantages? It has no cost, there are no side effects. Disadvantages, it's difficult to calculate the safe period reliably. It needs several months training to use these methods because you need adequate knowledge to use these methods, okay? And compulsory abstinence from sexual act during certain periods, such as during periods where ovulation is likely. Not applicable during lactational amenorrhea or when the periods are irregular. And failure is about 20 to 30%, which is very high. Then now we talk about intrauterine contraceptive devices. So I remember I mentioned it can be non-hormonal or hormonal. So non-hormonal is this one, which is the copper T device, and this is the hormonal device, which is levonorgestrel containing IUD. Okay. So what are the advantages? It's inexpensive. In some countries, it's even distributed free of cost through the government. Simplicity in techniques of insertion and most cost-effective of all the methods. Prolonged contraceptive protection after insertion, which is 5 to 10 years. It's suitable for the rural population and of developing countries. Systemic side effects are nil. There are no systemic side effects. It's suitable for hypertensive, breastfeeding women, and epileptics. Reversibility to fertility is prompt after removal. Disadvantages include it requires motivation. There are some limitations in its use. The adverse local reaction that are manifested by menstrual abnormalities, pelvic inflammatory diseases, pelvic pain, and heavy periods. That's usually in the initial period. Beside effects, there are less with the generation of intrauterine devices. So these devices have first generation, second generation, third generation. So side effects are less with third generation of intrauterine devices. And there's an increased risk of ectopic pregnancy. Failure rate is quite low, which is 0.1 to 2%. And now we'll talk about steroidal contraceptives. So this can be oral, parenteral, or device. So when we talk about oral, we've got combined preparations and single preparations. So in combined these, a combination of estrogen and progesterone. So that have to include monophasic, biphasic, triphasic. Okay. Then we've got single preparation, which is progestin only pill, which is also known as the mini pill, and we also have estrogen only pills. Okay. Then now we go to parenteral. So in the parenteral, we've got injectables and implants. So injectables, we've got DMP and combined, whereby you just have to give the injection once a month. There's some in which you give the injection once in 2 months, and there's some in which you have to inject once in 3 months. Then implants, you've got Implanon, Norplant 2, levonorgestrel rod. Then under devices, we've got intrauterine contraceptive device, levonorgestrel intrauterine system, which is this one over here. Then vaginal ring, so we have the levonorgestrel ring, or we also have combined ring, which is composed of estrogen and progesterone. And there are also transdermal patches, Nesteron. So what are the advantages of combined preparations? They're highly effective. They have good cycle control. They're well tolerated in majority. There are also additional non-contraceptive benefits. And low dose pill with lipid-friendly progestins further reduces the risk. Reversibility rate is prompt. Then disadvantages requires education and motivation. There are some limitations in its use. It requires initial checkup and periodic supervision. Inconvenience caused in its use due to daily schedule. There's risk of drug interactions. It's costly, but in some countries there's free supply through the government. Okay, and failure rate if used properly is 0.1%. So that's all about contraception. If you like the video, please like, subscribe. If you have any questions, please do comment. Thank you.